Hello, everybody. We'd like to welcome you to our next installment of Finding Your COVID Balance. Happy New Year to you all. We made it. We made it through this stressful holiday season, and we're still together. We're still working hard on our health and taking care of our families, and we're very fortunate and grateful that you're here with us today. We've had lots of conversations in my house just about what the vaccine means. I'm filled with young men in my home. And so we've had lots of good conversations about what the vaccine means, how are they coping, and I hope that you're having conversations like that with your household as well. One of my favorite quotes is Maya Angelou's, and that says, "Do your best until you know better, and then when you know better, you'll do better." So that's what these conversations are for. They are for us all to become a little bit more knowledgeable and confident in with our decision making, so that we can get through this next point period. And we'll be here with you. We'll be here monthly with you until that time. So I would like to welcome my friend Marva. Marva is our wonderful resident moderator. And thank you, Marva, for continuing to help navigate all the questions. And you do it very well as people are asking questions live. So Marva, I'll pass it over to you. Thank you.
Thank you so much, Tracy. Thank you for helping to start us out. Certainly back in May, it seemed like such a long time ago, but the year has ended, as you said, and we're all doing great. We're all doing fine, and we hope that everybody that's listening are feeling really, really good right about now. But we know that we all sometimes struggle from time to time. We're here to help, and we're here to support you in answering some of your questions and maybe to allay some of the stress that we all feel after the holidays, immediately following the holidays. And so each month, as Tracy said, Anne-Marie and Helen will be the two panelists answering your questions about the mental and physical implications of COVID-19 pandemic. And Anne-Marie, of course, Zajdlik is a primary care physician here in Guelph, providing comfort and guidance to thousands during this pandemic. Anne-Marie's Facebook has become quite a sensation. And indeed, many of my friends talk a lot about learning about COVID through Anne-Marie's Facebook, with Anne-Marie's daily posts of encouragement and really sound scientific knowledge about COVID-19 and other health issues. We're really grateful that she's a part of this panel and part of this ongoing information sharing for our community. And of course, I have to mention Bracelet of Hope, which is an incredible organization. Bracelet of Hope and Canadian Mental Health Association, Waterloo, Wellington, with Helen Fishburn, that I'm going to introduce in a couple of minutes, are the two main organizations that really started this out to ensure that you're having this information. And Tracy will mention a little bit more about Bracelet of Hope at the end. Helen, of course, is the CEO of the Canadian Mental Health Association of Waterloo, Wellington. She is a lifelong advocate for increased awareness of mental health issues, and she's dedicated her career to advancing the design of an improved mental health care system. And I know that you, if you live in this area of Waterloo and Wellington, you have seen, heard, or felt the impact of some of the work that Helen has championed with her team, and we're grateful that she continues to be a part of this here tonight. We thought that we would use the month of January to really focus on mental and physical effects of COVID-19. Last time we talked a lot about the vaccine, and of course we're going to be talking about that a little bit here tonight, but we really want to focus. We know that traditionally the month of January can be very difficult for many, many people. It's a shorter month of daylight, cold weather, and especially that many of you are used to getting away to somewhere warm, and that's not really going to happen too much this year. It's also flu season. You have the bills that are coming in from the holidays, and I'm sure you know a lot about the bills, especially many of you probably have a lot more package deliveries than you have had in the past because of this pandemic. This global pandemic and many of the other things that are taking place can cause a lot of anxiety and mental stress. We are hoping that tonight we can equip you with some knowledge and some tools that will help you and your families and all of your loved ones get through this month, both mentally and physically. We have a few rules, a few housekeeping rules, and I'm going to call them guide, and I'm just call them just sharing to help us out. I don't necessarily like the term rules. So let's just say that what we want to do tonight, whether you're joining us on this Zoom webinar, or if you're joining us via Facebook Live, we already receive many questions for either platform. So we're going to ask you to feel free to type out questions that you have. Now we're going to try to get to everything to the best of our ability. But if we don't, we will provide additional information for where you can get some of the answers that you might be seeking. As well, we're doing these webinars monthly. So we want you to come back next month. Tell others to come back as well to get additional information. We are recording this webinar, and so we're going to make it available to you on CMHA's website, so Canadian Mental Health Association, Waterloo, Wellington, their website, as well as on Bracelet of Hope's website, and on Anne-Marie's Facebook. So you have lots and lots of information, lots of places where you can gather information, and share with others. We want to get the discussion going. We're going to stop right at 8:15 again. We know that you've been absolutely wonderful in the questions that you've asked. We've not had to do hardly any sort of curation of getting rid of any questions. You've been lovely and respectful. We feel like you're an extension of us, and we want to get this discussion going. So thank you so very much again for joining us. And we're going to get the discussion going by asking Anne-Marie first and then Helen to just share a little bit of your thoughts, your opening remarks as we move forward with the questions tonight. Anne-Marie, please.
So I think we're in a really rough time right now. I think it's going to get rougher over the next 4 weeks. And then I think we're going to start to see much more of the sunshine. Maybe not in February, but much more. So I want to just remind people to look at the overall perspective. Adhere to guidelines now. You will not get COVID-19 if you're able to adhere to the guidelines. Some people in work situations cannot. Immunizations are underway, 100,000 so far in the province, with many vaccines pouring in over the next couple of months. And between April and June, we'll start mass vaccinations. I think in our public health unit, we'll give the opportunity for people to be vaccinated earlier than September. And also remember that as these vaccines are rolling out, we're going to see the number of cases in other countries start to fall as they roll out their vaccine campaigns. That's going to bring us hope. And as we get into April and May, remember, green grass, blue sky, flowers, we're not too far away from other things that make us hopeful. So hang on and hang tight.
Thank you, Anne-Marie. And Helen.
Thanks, Marva and Anne-Marie. It's always great to be with you both and our community. My comments are actually quite similar to Anne-Marie's, just in terms of a little bit of ground setting where we are right now. And it is a tough spot of our COVID journey. There's no doubt about it. Our federal, provincial, and local cases are higher than they've ever been. We're in our, of course, second provincial lockdown, which may be extended, as that right now the numbers are not going in the right direction. We've seen schools closed and shifted to online learning, which is really evidence that people struggled to follow some of the public health guidelines over the holidays. Even though the kids don't get quite as sick with COVID and don't transmit it as much as adults, it's still really hard when we see kids get COVID. Because of this, and because we want to prevent further spread of COVID-19, schools have been closed, shifted to online learning. Parents are at home working virtually as well. So basically that means we've all become professional jugglers. We're juggling work at home. We're juggling our kids who are online at home with school and work, many of our adult children as well. We have aging parents. It's a lot for us to manage. There are a lot of people out there who are really struggling. They're tired, they're fed up, and they're exhausted. as well as feeling discouraged as well, which is another reality of this situation. Not surprisingly, we've seen an increased mental health need and presentation across numerous providers, whether it's your family doctor, a counseling provider here at CMHA with us, or at our schools as well with our online support at schools. So what does this actually mean when I say increased mental health presentation? It really means that people are struggling to get out of bed sometimes. Their moods are very low, they're anxious, they're overwhelmed, they're very, very worried, not only about where things are at now, but in terms of what it looks like in the future. And sadly, people do have thoughts of suicide when things get this dark. And as we know, suicide is about pain. So it's a time where people are really, really at a low point. But here's the deal. There is light at the end of this tunnel with the vaccines coming. And as Anne-Marie said, we have a really small and nimble public health unit here. They're going to mobilize that vaccine as soon as they can. But we are in between the current realities and vaccines. We've got some time to go before we're completely there and we're feeling the effects of that vaccine. I'm certainly not telling you anything you know here. This is really ground setting. But while we wait for the effects of the vaccine to roll out in our community, we really need to hold on to that hope. And that's a really tough space for us to hold right now because there are a lot of people in pain and a lot of people worried. We continue to have people who are struggling to meet the public health guidelines because of that. We saw that at Christmas. We see that now as well. We really need to try and support those folks and have them really engage in those guidelines to be able to keep our community safe. So how do we get through this? There are ways, they're not perfect solutions, but they're methods that can help. Certainly there are lots of research from psychologists and trauma experts who have worked with people who have chronic illnesses and disabilities, who've been through war, that say, although it feels impossible, and although there will be losses, most of us will get through this disaster. When people in devastating situations can spot warning signs of mental trouble, when they can acknowledge and express the distress they feel, when they can focus on the present moment and then focus on those things that they can control, and certainly find ways to connect with others. Those are the things that will help us get through the darkest of these moments and help us build our resilience. So we're going to spend some time tonight talking about that practically. We're going to get really concrete and offer as much solution and hope as we can as we go through tonight's session.
Thank you so much, Helen. Thank you very, very much. So let me go to our first question then, and you will hear from Emery and Helen throughout answering the questions, but also they will be making closing remarks, and Helen will begin, and then Emery closing in reverse order. One of the first questions that we have having to do with hospitals. With the numbers going up and the worry about hospitals being over capacity, is it still safe to go to a hospital ER? And will they be able to treat us, or are they overrun as well?
Yes, no, both answers. So first of all, yes, it's very safe to go to Emerge. Very, very safe. Full protective equipment, full precautions in place. You will not get COVID by going to emergency room. You could get sick if you don't go to an emergency room. The areas of the province that may reach capacity in the next little while are the hotspots: York, Peel, Toronto. Areas outside, public health units outside of that, are doing fairly well. They're working on the edge, but not to the point where it's going to affect who's coming through emergency and who can get help if they need ICU help when they come to the emergency room. I think what's going to happen in the next few days is we're going to offset the number of patients in the ICUs in the hotspots by moving them to areas where the ICU capacity is still quite high, like Sudbury, like Guelph. Guelph is about to receive people from other areas. So it's brilliant. We're going to work as a huge provincial unit, shifting patients around to areas where the resources still exist so that we still can receive emergency care for other conditions. So please go to the emergency room if you need to.
You're on mute there, Marva.
Just going to go through the questions so that we can answer as many questions as possible. So I'm going to seem to be going through rather quickly, but I hope you don't mind because I want to allow time for Emery and Helen to have lots of time to answer. This one's for you, Helen. I'm a parent of a 17-year-old and a 13-year-old. They're both struggling with all the COVID restriction, not seeing their friends, and now complete online school. They have little to no motivation to do school and spend all their time in the basement playing video games. What can I do to help them? Tough one.
Yeah, it is. And it's actually a reality for really hundreds of people locally and around the province. And let's be honest, for a lot of kids, online learning is a challenge. By nature, kids are sociable. They want to be at school for as many social reasons as it is for learning as well. So especially kids that are extroverts. So not being at school is really, really hard. And as I mentioned earlier, parents are also struggling just because they are also at home and they're trying to juggle their own work demands as well. So that's a lot to manage in the home. I will say there are some things to think about, which, you know, every situation is different. Your child is different, but there might be some just general things to think about. First is, no matter how old your child is, give them as much control as possible over their day. There might be kids, for example, in high school that can shift when they learn. So they might be able to learn in the afternoon instead of the morning. They might be able to break learning up in their day. And as much as we try and give kids control over their learning environment, that's going to be really, really helpful. Also, it's really important to give kids incentives so that they feel motivated. And incentives are going to be different depending on your kids' ages. You know, for little kids, it might be that you agree to make some homemade cookies with them at the end of the day, or at the end of a tough assignment, it might be that you give your high school kids an Amazon gift card for $10 or something like that. There are things that you can incentivize for sure. I would really encourage you too, as parents, to think about the big picture and really let go as much as the small stuff as you can. We need to adjust our expectations around what's realistic. Kids aren't going to learn for 8 hours a day online at home. That just isn't a reality. So really focus and make that meaningful time as much as you can, even if it's 1 hour, 2 hours, or 3 hours that you can get, and really let go of some of the things we used to worry about before the pandemic, like screen time, for example. I think this is also an opportunity to talk with your kids about the stress, to name it, and to talk about ways to manage it. You can also model that yourself. As parents, we're going through it. I talk about that with my kids who are also working, and we're all managing this together. My husband and I have these conversations. We talk about the good days, the bad days we're having, and we all kind of support each other. No matter whether your child is younger or older, that's something that you can do together, and it creates that environment at home where you're focusing on positive coping, you're encouraging communication, you're connecting with each other, but you're also not hovering. It's important for kids to have their own space and do their own learning style, but to know that you're there to champion and coach them through it.
That's great, Helen. Lots and lots of information there for everyone who is listening, especially with kids in that situation. The next question is would be for Emery, and Carrie's asking, what is the difference between the Pfizer and Moderna vaccines? Can you have one of one and one of the other?
No. Easy answer. So you will have to choose one or the other, although they are very, very similar vaccines, almost identical in terms of how they work and in terms of their efficacy. But each vaccine has been studied in its own arena. And so there's no data that shows it's safe to get one vaccine at one dose and then 28 days later get the second vaccine. It's not recommended at all. And so people need to choose. Well, most people won't have a choice. When you're called on to come and get your vaccine, you will be told which vaccine it is. Maybe 7 months from now, you might be able to choose between vaccines, but upfront, it's going to be what's available to whichever population. The Moderna vaccine, I believe, is 28 days between vaccinations, and the Pfizer vaccine is 21 days. And we really have to do all we can to make sure that if you've had the first dose, you're getting the second dose in short order.
Great, thank you. We have a poll, and it's a vaccination question. Will you get the vaccine when it becomes available to you? We continue to ask this in the last couple of sessions. The answer is yes, no, or still waiting for more information. We're asking if you could participate in this poll. We would really appreciate it. So while folks are participating in the poll, we will go to another question that will that we will ask. I know the poll, the responses come up very, very quickly, so we'll just come up with that. The next question. The next question is really related to vaccine. When you get the vaccine, you're presumably reducing your risk of getting COVID-19, but are you also less likely to give it to others? Abby would like to have an answer to that.
Yes, the answer is theoretically yes. It totally makes sense that if your immune system, if you're immunized to COVID, that you will not be able to pick up a COVID infection, and so you will not be able to pass it on. But the studies are still too short in terms of time to confirm that when you are immune to COVID, you cannot pass COVID on. There is an idea out there that once you're immune, you could still hold the virus in the front parts of your and therefore possibly pass it on to someone else. I do want to enforce that that's probably unlikely. We probably don't transmit when we're given the vaccine and we are immune, but that's not known yet.
Okay, so there's lots to know and lots to find out. Helen, Tricia said, well, Tricia might not be the name, but someone and others, many people have found themselves drinking more wine than usual over the holidays. And some are still continuing along that path, 2 to 4 glasses per day. It helps them to sleep better. How much is too much alcohol? And would you say that they might have a problem if they're drinking 2 to 4 glasses of wine per day?
Great question, and this is another one that it's tricky to answer because everybody's baseline is very different. What I would say is that this is the perfect storm right now for alcohol and drug problems. First of all, you can't go anywhere. And alcohol can be delivered right to your door, and it immediately impacts your mood. People feel more lighthearted, more social, more fun when they have alcohol or drugs. That might be a short-term solution, but unfortunately what happens is that can become a long-term problem. So it's something to be aware of. Definitely, how do you know you have a problem? There's some warning signs for sure. If you're drinking when you're stressed, if you're drinking when you're bored or lonely, if you are dropping balls at work or at home, some of your responsibilities you're not following through, if other people are expressing concern to you, if you're really not feeling great the next morning and that lingers, so you really start to feel physically not well. Those are all signs that there is a sluggish impact of alcohol or drugs on your body, and things for you to pay attention to. The provincial government actually lays out healthy drinking guidelines for us. And again, it's interesting because everybody's baseline is different. For some people, it might feel like a lot of alcohol, and for other people, it might feel like very little. But for women, it's no more than 3 drinks at any one time. For men, no more than 4 drinks at any one time, with no more than 12 in a week, so in a 7-day period. So in answer to your initial question around 4 drinks a day, according to these guidelines, that would actually be too much because you would surpass that 12 drinks a week. If you stick to the healthy guidelines, you're not getting impaired or drunk. There aren't physical implications or consequences from drinking. The chances of you suffering any kind of consequences to your relationship or at work is much lower. And you're living in that zone where it's moderation. So if you're drinking every day to that level, then you're going to experience more consequences. So if you can keep in that moderate level, the consequences of drinking is far minimized, and then you can actually enjoy it and feel the social benefits of it without having the guilt or the worry that it's becoming a problem. So 3 drinks for women, 4 for men at any one time, with no more than 12 in a week. That's what the government suggests.
So thank you very much, Helen. The poll, there was a poll that with the question, have you found that your drinking and or substance use has gone up during the pandemic? And 29% said yes, and 71% said no. I'm going to leave that with Helen. Maybe toward the end, you can comment on what the implications of that might be. Do we have the response to the first poll that we could throw up? We have a couple of amazing people in the background, Allison, especially with her team, Tanya from CMHA. And they're really doing some really great work. And here's the poll results for the vaccine when it becomes available. 93% yay said yes, they are going to take the vaccine, and only 1% said no, and only 6% still waiting. I think the highest we've ever gotten on this, and someone on the panel can correct me if I'm wrong, is about 80 something percent, 88% maybe. And Marie probably has the numbers right down. I can see her reaching in there. So this is a significant increase, and we're really delighted. We want 100%, but we're feeling really good with 93. We just need a few more percentages, and then we'll feel comfortable. Anne-Marie, did you want to comment on that?
I think that's excellent. I think in this group, we might be preaching to the converted, which is wonderful. I hope there are thousands of people who will watch this and who will be converted. But we really are not going to climb out of this pandemic without widespread use of these vaccines. We know that now. There are way too many people on the globe who are infected, and there are variant strains that are popping up. So that means that no amount of widespread lockdowns are going to get rid of the virus. The only way we're going to get rid of it is if we use all of our tools, and the vaccine is going to be one of the most important tools.
Okay, that's great. So let me just ask, the poll was really critical and really important. Someone asked a question, and it's just the same question, Anne-Marie, if you can continue in that vein.
Yeah.
How do you know when it's your turn for the vaccine, to get your vaccine?
So in the next couple of months, I just want to reassure people. I do this during the day when I'm feeling discouraged and low. And when you're working in any field of medicine right now, it's hard to keep your spirits up. So I will allow myself to become mindful briefly during my day and remember what's going on. We are being given deadlines for when people will be vaccinated. We think that during January and February, all the high-risk people will be offered a vaccine. And then by mid-March, April, mass vaccination clinics will be available. And I mean mass vaccination clinics. They're opening up the Toronto Convention Center and doing trial clinics there. And what they'll start doing is they'll start mailing people. So you'll be sent probably snail mail, because they don't have access to our internet address, our email addresses, but they do have access to people's addresses, because the address is connected to your OHIP number. Very confidential, but you will get a letter in the mail saying, you're next, please call this number to book an appointment, or go online to book an appointment.
That's great. Thank you for that, Anne-Marie. Sue writes that our daughter-in-law is a PSW. Their family all had COVID last April. Not very pleasant. She's back to work, of course, and I've noticed that lately the jokes she shares on Facebook aren't really as funny. She's worried about her, and how can they help? Helen?
I think the best thing is to take a really loving and supportive approach. If you see some red flags with somebody like that, who is obviously a PSW, is such a hard job. They're in the line of fire. They are doing an incredible service for our seniors, our vulnerable seniors, and they themselves are vulnerable, right? So taking a loving and caring approach with that person is key. You don't want them to get defensive or get their back up. Sometimes these feelings come out and you're not even aware that they are there. They can come out through inappropriate humor. They can come out through aggressiveness. Like you just, people are all struggling and everybody copes with it different. I think to just really tap that person on the shoulder in a virtual way and just say, hey, I'm just checking in with you. You've got a really tough job. You went through a lot last year. Do you feel like having a chat? We can have a Zoom meeting. We can have a FaceTime meeting. We can have an old-fashioned phone call. But I'm just really worried about you. You've been through so much. I'm here to support you. If that doesn't work, you can also really encourage the person to reach out for support formally, or you can reach out for support and bridge that person as well. But I would always start with just a really gentle, caring, and supportive approach, and just pointing out that you've noticed that there's just an edge there, and what can you do as a friend, and what can you do to bridge them to support.
That's great. Thanks, Helen. We're off to vitamin D. We've been
Yes.
hearing a lot about vitamin D for so long, since COVID started. And the person wants to know about the benefits of increasing its intake with regards to COVID treatment, of course, and possibly prevention of more serious illness as related to COVID.
So I'll take that one. So as most people know, vitamin D is very necessary for many of the metabolic processes in our bodies. And people living in the Northern Hemisphere, a study done years ago, most of us are vitamin D deficient in the winter months. And to get vitamin D from sunshine requires too much exposure to the sun. So vitamin D is recommended for everyone in the Northern Hemisphere to take, including babies, children, adolescents, adults. The guidelines for vitamin D in the medical profession, I think right now say 1 to 2,000 international units a day for people who are the size of an adult who are an adult, and 400 international units a day for littler people, including infants. But recent research, and there's been a lot of research that says 4,000 to 5,000 international units is really the sweet spot that's needed to get everyone's vitamin D levels into the normal range. And unfortunately, we can't test everyone's vitamin D level. It's not covered in this province by the government. And so you have to be in a certain risk group to have the vitamin D level paid for. There is ongoing observational studies in people who've had COVID that is showing that if a person's vitamin D level is in the normal range, that they are less likely to get COVID and less likely to go on to serious complications and death from COVID. And because vitamin D is so low risk and we need it anyway, about 130 researchers, physicians, and scientists in the States have signed a document saying, we think it's a good idea to start recommending 4,000 international units a day of vitamin D during COVID. Low risk, high payoff, even if there doesn't seem to be much evidence that it works in COVID-19. If it does at all, take it. So I actually take 5,000 international units a day, but I have been for years now, just based on the research that I've been following.
I would also
That's
add,
really
Marva,
good.
that
Yes.
you get a sun lamp as well. And just, on days where it's really cloudy like today and we didn't see the sun at all, it's hard for people. So that sun lamp actually really works. I don't know if you remember on Saturday this past weekend, we had a beautiful day of sun and you could just see everybody's mood was elevated. So if we can't count on Mother Nature for the sun, a sun lamp definitely helps.
That's great. That's really good to know. I know that for myself, my physician has always encouraged me and my family to take vitamin D because of the melanin, the darker pigmentation of my skin. The sun doesn't come through as readily as it would. So I've always taken vitamin D and I always know when I'm vitamin D low. Now I know that the sweet spot is 5,000 K. So that's really helped me a lot as well, and my family. And I wondered too, you hear a lot about how COVID-19 has impacted some people and not others. So I wonder if culturally there are some things there that researchers are also looking into in terms of the impact of a lack of vitamin D, deficiency in vitamin D, and those who have more vitamin D in their system. Just thinking out loud about that. Maybe I need to talk offline with Emery about that at some point. Another question, and this one's for you, Helen. I am in Brampton, the epicenter, and have loved the Facebook posts, Emery's Facebook posts. I am a senior trying to keep a group of seniors going. And with a daughter that's treating COVID, sometimes having a hard time keeping optimistic when I know it's what is happening on the front lines. What are some things to help?
Great question, and we definitely have seen seniors struggling more for sure. And you know, there is that isolation, and certainly because seniors are in a high-risk group. What I would say is definitely there are things that you can do to combat, where possible, reduce your feeling of that isolation as much as possible. And certainly for seniors, that's challenging because we're really encouraging seniors to stay within your home and really try not to go out as much as possible. So that means picking up the phone, talking to people. That means using your iPad or your smartphone, if you have one, to do a FaceTime. We have lots of seniors who love Zoom, who love technology, and then we have other seniors that don't feel comfortable with it. But you can always pick up the phone. We have wonderful groups out there. There are friendly visitor services, for example, that call into seniors if you don't have a family network that you can rely on for that human contact. We also have people who are dropping off meals, who are dropping off things for seniors to do, like puzzles and books and knitting. I've seen online knitting classes, for example, where seniors can learn how to do a hobby or learn to do things via Zoom as well. So reducing that social isolation is really, really important. Taking care of your physical health is really important as well. Nutrition to seniors is absolutely huge. If a senior is dehydrated or has any kind of infection, they're going to have significant consequences compared to adults or children and youth. Their metabolic rates, they can really get unstable very quickly. So it's really important to keep well hydrated and to eat well. Sometimes actually dehydration looks like delirium or dementia. So having that hydration is so critical. Sunlight, vitamin D, as Anne-Marie mentioned, is really, really important. And practicing self-care. So doing the things that give you joy. Again, whether that is something solitary, like a puzzle or a book, or whether that's actually something, you know, a lot of people are missing going to church, going to senior centers, doing things socially, but there are still many ways that you can connect with people, making sure that you're going for walks, getting some fresh air. You can still do that and maintain public health guidelines. You can go to church online. So there are lots of things to fill your day. If you can create a bit of a calendar and share that with people and get some other ideas from people, those are also great networks and great supports that you can connect to.
Great, super strategies. Emery, we've been hearing a lot about the COVID strain, the more contagious strain out of England and I think South Africa. Will the same preventative methods still work as well with the original strain and with wearing masks?
Yes, they will. Just to talk briefly, the United Kingdom variant is called COVID-19 B117. And it has, I think, 14 or 15 mutations. The variation or variants are completely expected. So this is not a shock to anyone that after 10 months of the virus replicating on the planet, we have variant strains developing. These viruses are RNA viruses. In your cells, you have DNA, and some viruses are also have DNA. If you have RNA in a cell, it's just not as stable. And so as it replicates, there are more chances for it as a result of being genetically unstable to develop mutations. The public health guidelines will still work, but you have to be really strict now. And I hope that message gets out there as we know more about the number of variants that are in Canada. So far, they've picked up 16 cases. Guaranteed, there are a lot more than 16 cases. The testing we're using in the province of Ontario, it takes 2 weeks to get test results back to test for the specific variant. And in the province of Ontario, as a result, they're developing their own PCR test that will be much more quick. And every test that's done eventually will look for both COVID-19 and COVID-19 B117. But I think we should now be wearing masks all the time, unless you're in the house with your the people in your bubble. I think when you're outside, we should be wearing masks. I think you have to be strict about the 3-layer mask, not a 2-layer cotton mask. Get that polypropylene in place. If you don't have a 3rd polypropylene layer, wear 2 cloth masks so that you have 4 layers of cotton. And really make sure that mask fits. I was speaking to a patient today whose mask kept slipping under his nose because it just wasn't fitting well. If you have a tight mask that's covering this part of your face, 3 or 4 layers, depending on the material, you will not be able to propel virus out of your respiratory system and allow it to get to someone else. We have to learn about the variant to understand why it's more infectious. But the theory is that it's more infectious because if it gets into your respiratory system, it's better at latching onto those cells in the back of your nose and getting into your system. So it kind of overrides your immune system's first response and makes it more likely that you will get COVID. But there's no evidence to say that it is more infectious in that it sneaks out of a mask more quickly and reaches out to the next person who's less than 6 feet away more quickly. So all of our measures should work, but we have to get them into place and use them consistently because there's just no room, any wiggle room anymore for not using a mask, washing your hands, and staying 6 feet apart. I'm hoping overnight that there will be changes to our restrictions that make it easier for everyone to understand what they need to do. But if you're outside going for a walk, I carry a mask in my pocket, and as I see people coming close to me, I put that mask on. I feel so bad and rude as a nice Canadian for doing that, but I think those folks appreciate the fact that I don't want to give them COVID, and that's my main reason for moving aside and putting a mask on is I don't want to pass this on.
Thank you, Anne-Marie. Thank you. Lots of good information. Helen, any suggestions regarding mental health and seeing a psychiatrist? The person says that I'm in a remote community and they cancel psychiatric outreach due to COVID. Other communities have a wait list of months or greater, and it can leave one feeling hopeless.
Yeah, so that's a real challenge. I would say that almost all of our psychiatry services, certainly here at CMHA, have shifted to virtual. And we're actually able to offer increased time, increased a number of sessions with our psychiatrists because of that. I know they're doing that in the north as well. I don't know where specifically this the person who asked the question is from, but I know because we meet provincially, all of the CMHAs in Ontario, there's 33 of us, and we meet monthly. And I know all the other CMHAs have also shifted to virtual care. The challenge we have for sure is that there is not enough psychiatry, and psychiatry is prioritized based on risk. So if you're seeing a psychiatrist very quickly, it's because you're at risk. And those people that are imminently at risk, either because they're suicidal or homicidal, are seen extremely quickly, and then it works its way down. So that's what happens when you have a scarce resource. You have to be able to prioritize it. So what I would really say is work through your family doctor. Family doctors, obviously Anne-Marie is quite exceptional because she has an exceptional knowledge of mental health and wellness, but many family doctors do as well. And they might be able to prescribe something or offer something in the short term, but they also might be able to find a bridge or build a bridge to get that psychiatry session as well. There are some centralized psychiatry resources being offered in the province as well. CAMH is one good example of offers psychiatry throughout Ontario. It doesn't matter where you live. So if you work with your family doctor as a partner, you might be able to find various opportunities. Also, your local CMHA is also a great resource.
Great. Thank you. Uh, Another question from a participant. For Anne-Marie, my area was green before the current lockdown, and I'm concerned about COVID patients being transferred into our hospital. We'll bring it into our community. What precautions are being taken for that? And perhaps while you're answering that question, Anne-Marie, you could answer a quick question about someone who says their health card is expired, and will they still get the vaccination notice letter even if their health card is expired?
Yes,
So
but
two
this is
questions
a good
in one.
opportunity for you to update your health card number.
Yeah.
No one will be turned away from a vaccine. No one. But you should update your health card number, because there are situations where you would never be denied care in this province if you don't have an OHIP card, but you might be charged for that care, not with the COVID vaccine. And then the other question was about high or ill patients being transferred to ICUs in green areas from red or lockdown areas. These people will be transported in ambulances, either on the ground ambulances or air ambulances. They will almost be, they can't pass the virus on to the people who are transporting them. And then once they get into hospital, there are a myriad of restrictions, precautions in place, because we want to protect the healthcare workers, and they will happen wherever a patient goes. I doubt that a patient in the ICU in your area would ever interact with a community member, and they would be sent to a step-down ward or a hospital bed for recovery, and as soon as they were well enough, shipped right back door to door to the hospital in their community. Not a risk at all.
Great. And another question, how are homeless shelters affected by COVID-19? Are they still open and accessible to the public? Either Anne-Marie or Helen can respond to that.
Sadly, our homeless shelters right now are really being impacted by COVID. They're in outbreak, and that is actually in Waterloo region as well as here in Guelph, Wellington. Not surprising, it's a very vulnerable population, and our cases of community spread are at an all-time high. So our vulnerable population is going to be impacted by that community spread. I'm surprised actually it took this long for our homeless shelters to go into outbreak, which really speaks to how well they have been organized and run and supported up until now, but it has definitely caught up with them, and they are doing absolutely everything safely to manage the outbreak. Public health is involved, and all of our partners are really doing by the book management of that outbreak. So right now we can't get people into homeless shelters. I was actually on a call today talking about our plan B for those homeless folks who can't access the shelters. We are managing that through here 24/7. And we're making sure that people who are homeless, and today, for example, we had several people discharged from hospital who didn't have anywhere to go. So as a system, we really need to respond to those folks. And we have an ability to do that through some flex funds, through our mental health funding, which we do on an individual basis. So if you find yourself in that position and you're here in Waterloo, Wellington, certainly call here 24/7, and we will certainly do everything we can to make those arrangements.
Great. Is there a website as well? Is it the CAMH websites that you, Canadian Mental Health Association website that you go to?
Either
if not phoning?
CMHA website for sure, so that's cmhaww.ca, or our Here 24/7 website, which is here247.ca.
Here 24/7, and that will be on the website, and that information will be shared as well. Once we are done, we talked about providing you with the resources that you need on the call, and that will be one of the resources. I'm going to double up on a few questions now because I'm mindful of time and the number of questions we have. As always, never enough time to answer all the questions. So, Anne-Marie, I'm going to have two questions for you. Actually, it's going to be three in one. It's three separate questions, but one go at it. Regarding 4,000 International Unit of Vitamin D daily, should a person with heart disease or kidney disease consult with his or her specialist before increasing the dose from 1,000? And the next question, unrelated, are dentists being prioritized? And the last
The
question,
vaccine, yeah.
regarding the vaccination program, is Ontario diverging from the priorities outlined by NACI, NACI? I don't know what that acronym means, and maybe you could share that with us as well.
I'll answer the last question. They may be diverting a bit from the NICI guidelines. And you know what? I have to look up that acronym or I'll get it wrong. But they're national guidelines. You can look them up. I actually reviewed those guidelines last night. I don't think we're straying too far from those guidelines, but each health unit will have their own vaccine rollout committee, and we have a provincial task force, and they can make their own guideline decisions based on areas, based on case counts, based on how their particular healthcare system works. So it wouldn't surprise me if we diverge from those guidelines when it's appropriate to do so. And I think I know who asked that question. Call me later and I'll clarify that if I haven't answered it well. I believe dentists are going to be lined up with paramedics and firefighters and community-based physicians who are seeing patients in the office. When will that be? We will know soon. So I think we'll get guidelines very quickly that tell us specifically when certain groups will get the vaccine. But at this moment in time, public health units and the province aren't certain how much vaccine they're going to get on a week-to-week basis. And so until there is a huge flow of vaccine into the province and into the individual units, they can't really comment on who is going to get the vaccine when. It's going to ramp up very quickly. We're going to see more vaccine earlier than expected. We're going to immunize people earlier than expected. It's all a win-win story. Just stay tight and get that vaccine when it's available to you. The vitamin D question, it's safe for people with kidney and heart disease. Heart disease for sure, but I think kidney disease depends on the type of kidney disease. So you may want to discuss that with your primary care provider because there's lots of different types of kidney disease. It is a fat-soluble vitamin, so I don't believe it's metabolized by the kidney. I think your kidneys are safe, but check that out according to your situation. Was that 3? 1, 2, 3?
Oh, that's 3. That was awesome. That was really good. I needed to be doing that beforehand. That's a new strategy now.
Every patient asks me about 10 questions, so you can probably go to 10 if you want to.
That's really good. I'm going to be doubling and tripling up. No worries about that. Then I will lose track if I go to 10. No, that's great. And of course, it goes without saying, anything that you are doing, that whether medication or otherwise, you're always checking in with your own family physician for your own personal health history and health care to make sure that that is okay. That goes without saying. I'm going to double up on yours, Helen, because one is really, really super long. So you're getting 2 instead of 3. And the first one is, how can I convince family members to follow the guidelines? And then the second is a longer one. If you're homeschooling your kids all week and about to hit the ceiling because you're not only trying to teach and take care of your kids, but also working, and I'm visualizing this person on the ceiling, it's pretty funny, but not really, how best to cope with all of this stress and pressure? And the person thanks you, and your advice and clarity has been a breath of fresh air. So just to pass that on to you as well.
Oh, great. Anne-Marie and I really like to be realists, right? We're feet on the ground.
Are.
What do we need to do? So in terms of family members, I think it's really hard, especially when they're adult family members and they can make their own choices. I think honest and real conversations around evidence and facts is really important. Not fears and not conspiracy, but actual facts and science. And then actually some stories around people who've lost their lives of all ages, by the way. I think just really living in the real world. And of course, if that doesn't work, then you have to set your own boundaries to keep yourself safe. Because ultimately that's really the only control that we have is around ourselves and our immediate family, and that's really, really important. Sorry, and the second question was around how to cope with a parent that is really stressed out.
And so, teaching their child at home. Yeah.
teaching their child at home. And this is this professional jugglers syndrome
Yes.
that we all have right now, right? And it's really, really hard. And there is a lot of pressure on all of us, first of all, with our own workload, our kids, and to keep it all together. And by the way, as parents, and we're all, you know, I'm a parent, other people are, everybody's parents on this panel, we're all struggling to do the best we can, and we have our own reactions. We all are managing and leading our way through this, and at the same time experiencing it. So each one of us needs to be aware of our own days where we need help, we need support. You know, on Fridays when I come home and I say to my husband, I am done. I can't, you know, don't ask me to say anything more intelligible. It's finished. You know, we all need to know our limits and then plan for that. So I really admire this person who's asked the question. She knows, like, she's on the ceiling, she's done. So that's the first thing. Know yourself and know when you're in that spot. Second of all, if you can, you know, intervene before you hit the ceiling, that's always helpful. So try and talk to your friend, disconnect. Put your child in front of the TV, allow them to watch a movie. Maybe they can do some screen time, have some quiet time, and you can have your quiet time. It's really important in those moments to do some deep breathing, to collect your thoughts, to maybe just step out on the porch, get some fresh air, to have a quiet cup of tea, to call a friend and say, I'm losing my mind because I am just so stressed and I'm overwhelmed. And just to have that support is so critical. If you don't have any of that, Here 24/7 is always available. And if sometimes people don't want to call a friend, and that's okay too. Here 24/7 is literally available, whether it's 2 o'clock on a Friday afternoon or 4 in the morning on Sunday because you can't sleep and you're so burdened with that stress. So please reach out informally or formally.
That's great. Thank you. That was great with the two, Helen, especially with the longer one at the end. I have another poll question for you, everyone. The question is, how hopeful are you that we will get through this in 2021? So how hopeful are you that we will get through this in 2021? And it's a multiple choice question. Yes, I'm hopeful. Or maybe, but I still have doubts. Or no way, this isn't going away anytime soon. Of course, both Helen and Anne-Marie keeps telling you that just hang in there. It's coming. So we will get you the poll results in just a minute or two. If you could answer that for us, that would be really quite wonderful. This next is for Anne-Marie, and it's a couple of questions again. There have been some conversations about the Wellington Dufferin Guelph Health Unit not administering vaccines on the weekends. Do you know anything about that at all? And of course, we're going to have Dr. Mercer on at some point in February or so, and she'll be able to explain all of that. So if we don't have the answer here, I am sure that you will be able to find some answers down the line. But I'll still ask anyways, Anne-Marie. And the second, is it true that long-term staff vaccinations is at about 53% rate, which is quite different from the 93% of the audience? And of course, as you said, we're preaching to the converted for the most part, but nonetheless, it's a good representation of a number of people across our community who are saying, yes, the sentiments of people saying that the vaccine is okay and it's going and trending in the right direction. Can you comment on those two items?
So the first one I'll answer very quickly. There will be weekend vaccine clinics. There will be a mass vaccination clinic in our public health unit. I know that for sure. And it will open 10, 12 hours a day when there are enough vaccines to give. There is no point running a weekend clinic right now if you don't have vaccines. So what the unit is doing now is having people call for appointments, knowing how many vaccines they have, another load of vaccines and be able to distribute them. I will say in Nicola Mercer's favor, because she's my hero,
Yes.
she was really ahead of the curve in terms of our unit these vaccines. She was able to secure freezers that go down to minus 70 degrees Celsius well before the vaccine was approved for use in Canada. And as a result of having those vaccines available, which can hold something like 250,000 vaccines, our public health unit is the only one so far that are separate from a designated site chosen by the federal and provincial governments. And I think our region is going to be immunized more quickly than the rest of the province. I'm guessing that because we have the capacity for those vaccines. Pfizer will not give a unit of vaccine if they don't have those freed up freezers. So kudos to her. But the fact that they're not running on weekends is because we don't have enough vaccine yet to do that. And then what's the other question? I didn't really understand something about, is it 50%?
Yes, it was long-term care staff vaccinations. I guess maybe it's across the board and in the news that it's only at about 53% where people are saying yes to the vaccine, which is quite different from the 93% of our audience that said yes, they are going to get the vaccine. So
okay,
it's
so
not scientific at all.
Yeah, I've heard higher numbers. I've heard that it's as high as 70% of people will get the vaccine, and that's just from different readings that I've done or things that I've read. So I think 53% or just a little bit above 50% is quite low. I think there are a lot of vaccine hesitant people. So I think there's probably 15 or 20% of people that are saying no way. And then a good chunk that are saying maybe, but I'm hesitant. And those are the people we really have to encourage. And then a smaller percentage that are like, just like I'm rolling up my sleeve right now kind of thing. Does that answer the question? I think it's much more hopeful in that respect than we see right now.
Yes, no, that answers the question. That's great. Thank you. Okay, so the answer to the poll question, 74% of people say that they are hopeful to get through 2021, and that is really quite wonderful. And there's some that say, I'm getting through it, but I have my doubts. That's about 24%, and only 2% say, no way, this isn't going away anytime soon. And so, the 2%, our heart goes out to you, and we want you to keep tuning in and listening and hearing, and hopefully the information that we're sharing will be very helpful to you. But it really is quite good to see a good 98% of folks feeling pretty good about getting through this pandemic and everything else that is happening around it. The last question that I have, the last two questions, there has been indication that people with allergies can experience adverse effects with the vaccine. Could you speak to that, Helen? And then, Anne-Marie, what criteria will be used for contacting people to obtain the vaccine? Whether age, pre-existing conditions, etc. And I think some of that information is probably going to be posted, but folks are trying to find that out. And after you answer these questions, I'm going to ask Helen if she could begin with her closing remarks, and followed by Anne-Marie, and then I would take it from there with Tracy.
I'm actually going to defer that allergy question to Anne-Marie, who's really our vaccine expert. I know that some allergies are impacted by the vaccine and some aren't. What I don't know is which ones. Anne-Marie, do you know off the top of your head?
I am not a vaccine expert. I will answer the question.
On this panel, you are.
Yeah. Okay, so the next two posts that I write will be on adverse reactions. Every drug that you take, every intervention in medicine, when it involves some sort of treatment, has adverse reactions. You're going to be shocked in the upcoming posts when I show you how many adverse reactions are associated with antibiotics, medications for diabetes, medications for high blood pressure, medications for depression and mental health issues. Much higher adverse reactions with classes of drugs that we've been using for decades and accepting the adverse reactions because the risk of not treating is so much higher than the outcome of the adverse reaction. This vaccine has an extremely low adverse reaction rate. Of the millions that have been given so far, there are 126 adverse reactions, most of them mild to moderate, to people who had allergic reactions. That is unheard of. And it's because the technology and the biology of the vaccine just really can't cause an adverse reaction unless you are allergic to the component parts of the vaccine. If you look up, I will try to post again what the component parts of both the Moderna, what the ingredients are of both the Moderna and the Pfizer vaccine. But mostly the ingredients are fats that allow it to be put into the muscle and move into the cells. It's got to be transported by something, and the most sensible thing to use is a fat, because the body recognizes a fat. Polyethylene glycol is in both vaccines, and that is the ingredient that is most likely to cause an allergic reaction. But allergies to polyethylene glycol, that's used in bowel preps before you have a colonoscopy, and it is also in Restorelax, a good medication for constipation. So people who have had an allergic reaction to polyethylene glycol should not get the vaccine. Otherwise, there are penicillin allergy, you're fine. Nuts, you're fine. Fish, you're fine. I think we're watching people who have lots of different complex allergies. Those folks should talk to their primary care provider and maybe hold off on getting the vaccine. But otherwise, single allergies here and there, go for it.
Great, thank you. Thank you for that. There are a couple of questions around vitamin D. So it seemed like it requires clarification, although I had said that we would move on to the closing remarks. So let me just throw those in, if you don't mind. The first was, with taking 4,000 and 5,000 units, should it be administered twice, 2 different times instead of taking all at once? And this is what someone is asking. And the other question around that is it the vitamin D, or are you talking about vitamin D3? That's what another question was. So I thought that was important to clarify before we get off the
So I will clarify the D versus D3 thing after doing a bit of research, but from what I know now, the two are the same, and they can both be used in the dose of 4,000 international units. If I do some research and change my mind, I will post that. Twice a day, it's once a day. Typically, and the dose does not need to be split in half. There are some people who have some gastrointestinal reaction to vitamin D. It's extremely rare. Like one patient of mine in 25 years had an adverse reaction to vitamin D, but he had osteoporosis. We really needed to get his vitamin D levels up. That is one reason that OHIP will cover your vitamin D level, is if you have osteoporosis. And so we did split his dose into 2. I've also had patients with osteoporosis who have needed 100,000 international units of vitamin D spread across a week. So we just increased the dose until someone is responding. And when you get to those higher doses, we do start to split them, but not at 4,000. Once day's fine.
That's great. Thank you. Thank you so much. Wow. Helen, reflections on this wonderful session and all of the great people that have phoned in.
Take your time, Helen, and I'll answer a bunch of questions while you're doing that.
Okay. Sounds great.
Well, once again, we just really appreciate people joining us for these conversations. They're so important because it really just means we're coming together to be part of that journey together. And what we know from a mental health perspective is the more we can be connected and support each other, as well as continue to build our skill set and our knowledge, that's how we're going to get through this. Remember when we talked last month about resilience, and resilience is an absolutely wonderful foundation, but it ran out months ago given the length of this pandemic. So we continue to need to add layers onto our resilience right now as we're in this last home stretch as we wait for the vaccine. So that's really important. I'm just a bit worried right now that things could get worse before they get better. And that's really tough on us emotionally. As we wait for the vaccines to roll out, our mental health is a really important part of our ability to follow those public health guidelines. So it's literally never been as important to take care of ourselves. It's literally a lifesaver. So the vaccines are coming. We know that there will be a methodical rollout, and it's something we're all going to be certainly celebrating. Changes will come, improvements will come, and there's always times where we think we can't manage another minute, and then we do. we just keep going. And I think we need to continue to be flexible. We need to continue to be open and honest with ourselves about how we're managing, to know when to reach out to others, to reach out formally to our support system. But at this point of our juncture, we really need each other as we get through this next phase of things. And certainly learning to take one day at a time is really, really important. So 3 things I really want you to take away with you tonight in terms of a mental health perspective. First of all, stay connected. It's super important to have your support system close. And if you don't have a support system, we have a great mental health and addiction system here locally called Here 24/7. Stay active. That physical activity is so important for our mental health, whether it is a 30-minute walk with some fresh air, or a walk on your treadmill, or just some stretching and some exercises in your home, depending on what you can do. And then the third thing, of course, is to stay safe, to follow those public health guidelines, because of course that also makes you feel good and gives you that sense of control that you can do. Stay realistic about what we're dealing with right now, but certainly stay hopeful, because we know that 2021 is going to be a much better year.
So I'm going to buy some more time for Anne-Marie as she answers and recap the different stays. You said 3, but you actually gave 4 brilliant ones. Stay connected, stay physically active, stay safe, stay realistic, and stay hopeful.
There you
Those
go.
are really wonderful takeaways.
Math is not my
that,
strong
Helen.
suit, Marva.
That's okay. It's
My
my
husband
job
will
to
tell you
track
that.
that, so that's okay. Thank you, Helen. This was great. Wonderful. Anne-Marie.
Okay, so I've got a few minutes. First of all, there were a lot of questions about when do you think I will get the vaccine, or when do you think my group will get the vaccine? I know that people are very anxious. Believe me, these vaccine task forces and rollout committees are making the right decisions about who gets the vaccine first. We need to immunize our elderly folks in long-term care, their support workers, and the staff that work there. We need to get every single person working in the hospital setting vaccinated, because there's about to be a huge rush of COVID patients into the ERs and into the ICUs over the next little while. We cannot avoid what is about to happen. We can protect ourselves from it by following the guidelines and laying low over the next couple of weeks as that surge post-Christmas happens. But guaranteed, you will know in short order when you are in the queue. And if you are a member of the general public with no major illnesses and you're under the age of 65, mass vaccinations for the general public will start in April. I know that sounds like it's a long way away, but it is not really in the grand scheme of things. I don't want to minimize what people are going through, but the way I look, because I don't expect to be vaccinated until the mass population is vaccinated as well. So the way I look at it is, I'm going to try to use all the resources I have, as Helen pointed out, all the wonderful tools. I've not used tools like that before, but I am using them now because I need to stay mentally and physically fit to get through this. And one of the main things I do is I say, things could be so much worse. We have a vaccine. 3 months, it's going to be tough, but then the sun is going to come out, both environmentally and when we start to see those numbers climb down. Do you remember in the summer how excited we all were? We thought, like, we're on this team and look at, we're winning. In July, the number of new cases was at 30 new cases in a day in July. And we were all so excited. You're going to see that again. And the momentum that comes from seeing the success of our lockdown measures and our immunizations is just going to make us all feel so much better and give us a boost of resilience that is really, really hard to find right now. I have incredible hope. There's no question to me that we're going to control COVID-19 and get back to our normal lives. COVID-19 may become a part of what is a part of our communities for many, many years to come. But if you're immunized, you're safe. And illness that we get from COVID-19 once we're immunized will be mild and not people ending up in ICUs, not a high death rate. like what's happening now, and not long-term complications from organs that have been messed up by the virus. So you got to stay hopeful. You have to, because you should. There is lots of evidence and lots of reasons why you should stay real hopeful and keep those thoughts positive, because once they turn negative, man, it's so hard to climb out of that pit. It's so difficult. So every day, as soon as I feel any anxiety or low mood, I say to myself, you cannot go there. You must not go there. You can go there for a minute or two, but right now you can't go there, because if you can't come back up, it's so, so difficult.
Thank you,
End of
Anne-Marie.
rant.
Thank you. No, that's great. Perfect, because we have 1 minute for wonderful Tracy Curtis, Chair of Bracelet of Hope, to do our closing remarks, and for us to thank Allison and Tanya, who's in the background making this work so well. And thank you all for joining us. Over to you, Tracy.
Yes, I get the lucky job to thank everyone. And there are people behind the scenes that are working hard with CMHA. And like you said, that is Allison and Tanya. So thank you, Allison and Tanya, for making this all go so smoothly. Now, everyone, I've mentioned this before, but Marva Wisdom, thank you so much. I asked you months ago to volunteer for one session, and here you are months later, still working hard, and we're just so grateful. Marva, you are a community leader, and we're so grateful for your time. Anne-Marie Zajdlik and Helen Fishburn, you are community leaders in this, and we are so grateful that you take the time. So this team volunteer. This is all extra time. Everybody's worked long days, wanting to come home and just put their pajamas on and just relax and just unwind. But instead, this team stays focused in this place, and it is only for you. It is for the community. It is for the public to help educate you, answer questions, provide you comfort, and help get through this. So we are in it together. We will be here again on February the 9th. Nicola Mercer has actually confirmed that she will be attending that night. We're going to be finding out more about the vaccination, so we'll have more clarity there. So that will be wonderful. Please tune in. So we learned so much. I know I'm going to be increasing my vitamin D that I'm taking. And I want you to know, from the last session, Helen made a point about using art and different parts of our brains to help us get through this. And from that, Anne-Marie, Marva, and I are all Rotarians with the Guelph Rotary Club, and we're starting a paint class partnered with CMHA. So you can just hop on and paint and just get distracted for a couple of hours. And so thank you. So you know, all of this, we will get through it together. We will be stronger. I will speak about Bracelet of Hope for a moment. So we launched a mobile clinic in March of just this year. That mobile clinic was to test and treat for HIV, AIDS in Lesotho, Africa, but also take care of maternal and children health. What it has quickly turned to is it's going to be also testing and eventually immunizing people in Lesotho. These are people that do not have access to healthcare. These are people that live in hills, that have to walk a day to get to a clinic. And their vaccinations will be able to get to them. So if you are able to donate, that's what this team is asking you to do. Visit www.braceletofhope.ca. We would be so grateful for your donations, and follow along. We have 6 foster homes. We look after about 40 children, and again, run the mobile health unit. So just a little chat about Bracelet of Hope. So thank you again. Anne-Marie founded Bracelet of Hope over 10 years ago. So we've come a long way together. So thank you, everyone. Thank you for your time. We'll see you on February the 9th. Hang in there, do all those awesome things. Thank you, Anne-Marie, Helen, and thank you again, Marva, for your time, and wishing you a wonderful month, and we'll see you again very soon. Take care.